Thanks so much, Greta. It's a pleasure to be here. Before we honor Dr. Shontelle Dodson, I'd like to draw your attention to the screen for a brief video.
I'm Shontelle Dodson, Executive Vice President and Head of Medical Affairs at Astellas Pharma. I am sincerely honored by this recognition from SWHR. At Astellas, our focus on turning innovative science into value for patients, with a commitment to delivering outcomes that matter to patients, is what drives us every day.
This extends to our commitment to advancing women's health. Women's health at Astellas means powering possibilities for women in midlife. We understand women seek solutions that enable a life of continued possibility. The entry into midlife should be met with confidence, knowledge, and community.
We must break down the taboos of talking about women's health, particularly menopause. This starts with an open dialogue and an ongoing commitment to let women know that they're not alone. And this challenge isn't finished. It will take all of us to make women's health mainstream.
Shontelle's deep experience as a clinical pharmacist and industry leader has provided her with the ability to understand multiple patient perspectives and directly address the unique healthcare needs of women in midlife.
When I think of Shontelle as a leader, she's really a connector. She connects people, and even in my function, she really pushes me, my team, our organization to really take our research to the next level, but always with a strong focus on the impact.
As head of Astellas' medical affairs function, Dodson inspires those around her. She oversees the largest division in global medical and development, skillfully connecting the mission of the organization with the vision of the company.
She leads, encourages, inspires, and motivates her team to perform in ways that create meaningful changes, pushing to achieve the objective that we have together to really and effectively impact patients' lives.
She leads by example, putting people first and helping others for the greater good, whether it's the patients she serves or the team she supports. Shontelle is fiercely dedicated to serving as an inspirational female role model and building the next generation of women leaders in pharma.
Shontelle has been a great coach and great mentor for me. So one of the things I learned the most from Shontelle is continuously develop yourself and then step out of your comfort zone. Absolutely, without Shontelle, I wouldn't be where I am today, in my career.
I am incredibly proud to be part of the Astellas team that developed a first-of-its-kind treatment for moderate to severe vasomotor symptoms caused by menopause. I'm also proud of our work to address barriers for women that too often prevent them from getting the care that they need. With my colleagues at Astellas and in my work with SWHR, I am committed to making women's health mainstream.
Dr. Shontelle Dodson is Executive Vice President at Astellas Pharma, Inc., where she is responsible for leading Astellas' global medical affairs activities for late-stage development and marketed products across all therapeutic areas. Dr. Dodson joined Astellas in 2012 and has held various executive leadership roles in both the medical affairs and commercial functions, leading those organizations through times of significant growth and evolution, while also passionately championing many women's health initiatives. She started her career in direct patient care at the Department of Veterans Affairs and also has extensive experience in the industry, previously serving in roles at Pfizer and the biotech sector. Shontelle is a former chairwoman for the Society for Women's Health Research and has served on SWHR's board since 2015, helping guide the Society's work to make women's health mainstream. Dr. Dodson has also served on the board of directors of the National Pharmaceutical Council, a health policy research organization dedicated to advancing evidence and science and fostering an environment that supports medical innovation. Dr. Dodson holds a Doctor of Pharmacy degree from Mercer University College of Pharmacy and completed a postdoctoral residency at the Department of Veterans Affairs Medical Center in Nashville, Tennessee. Please join me in congratulating Dr. Shontelle Dodson.
Thank you so much, Maureen, and thank you for all the great work that Lilly does to support the organization and women's health causes. Thank you also to SWHR for this tremendous honor. I'm incredibly humbled to be honored among such an accomplished group of professional women. It's an amazing group, and we've heard a lot of great things from them today. Thank you also for our distinguished guests that have joined us for this event tonight. At SWHR, we are so grateful for your support. And I personally am extremely proud of SWHR and the work that the organization has done to advance the needs of women. And I want to take a moment now to acknowledge the work that Katie has led us through in this organization since joining us as CEO in 2020. She has really helped SWHR solidify our position as a leading voice for women, advancing science, policy, and research initiatives that help improve the lives of women at every stage of life. As you heard earlier, SWHR is working alongside the White House Gender Policy Council, Congress, and our partners in the women's health community to ensure that the White House initiative on women's health research receives the treatment and the investment called for by Dr. Jill Biden and President Biden in a State of the Union address. And we thank you for your comments that you shared with us tonight. And I hope that all of us will really get behind it and advocate for the important work that will be done. We are grateful for the administration's leadership, and we are grateful for everyone in this room being strong advocates for women's health. At the same time, I think we all know that policy is just the start. We look forward to building on this and building a solid foundation to ensure that this policy translates into change for women across our entire country. And you heard that from Maria in her comments. There are so many women in need, and we need to be strong advocates for that. SWHR has also joined with our organization, Astellas, to elevate the conversation around women in midlife. We are proud to be working together to reduce the stigma associated with this time of changing healthcare needs for women during a transition, during a time where women are still such a vital, important part of the workforce and of the communities that we all live and work in. SWHR's groundbreaking impact menopause study and continued advocacy on women's midlife issues has enhanced the recognition from policymakers to really make a change and to address women's healthcare needs, forcing a shift from awareness to one that we're seeing now of action. And that's an important tide change that we all need to support. And Congress is taking action, as you've heard. Also, the bipartisan WARM Act, recently introduced in the House, would establish a menopause public awareness campaign. I think we need that. You heard from Maria earlier, 6,000 women a day, and we need people to be aware that that's happening, right? It also invests in medical education for healthcare professionals, another topic that we learned about tonight. And finally, we'll create regional centers of excellence for menopause education, all of which are so important. These are significant and welcome actions, but I know that our work isn't done. I'm asking that you please join me and join SWHR in our efforts to break down the barriers that limit opportunities and outcomes for women. And let's finally make women's health mainstream for good. Thank you.